Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists physician assistants with employment contract and independent contractor agreement issues. Today I'm going to talk about physician assistant offer letter mistakes. So what are some things to make certain you don't get taken advantage of, and then some standard mistakes that PAs make when they're kind of entertaining a new job. So the kind of standard way of handling a new job would be, you'd interview, you'd have discussion about the position, and then at some point, if they want to move forward, they may provide you with an offer letter. And then in the offer letter, some are more detailed than others, but it should hit kind of the most important terms. So how you're compensated, what are your benefits, maybe how much notice you have to provide to terminate the contract, brief details on restrictive covenants, so the non-compete, maybe non-solicit, are there any bonuses involved? So kind of the pillars of what are important to a PA, it should be listed in the offer letter. And so one question I get is, well, should I do the negotiation prior to signing the offer letter or after? You can negotiate after even if you've signed the offer letter. I find sometimes you'll see terms in the offer letter that look great, but when you read the actual language in the contract, it's significantly different. So you want to make certain that you don't, you're not, stuck, or don't feel like you're stuck after you've agreed to terms in the offer letter. But then when you read the contract, it's completely different. You can still negotiate. Now, an employer most likely is not going to take kindly to that. They may be like, look, we already discussed all this stuff. We've come to terms. This is just the formalized document, but you can't really think of it that way. If you've received a contract and it's different, or at least when you read the fine print, it's different from what the offer letter is, then absolutely you need to go back at them and say, look, this is not necessarily what you said in the offer letter. We need to make changes if I'm going to move forward with this. But let's say you've received the offer letter and you do want to make changes. What's the best way of handling it? Just ask. If the base comp is not where you want it to be, you need to ask for an increase. If the bonuses are not where you want it to be, you need to ask for an increase. Same with the non-compete. If it's too long or the restricted area is too broad, this is the time to ask for it. Now, another question I get a lot is, well, if I've signed the offer letter, is it binding? And in 99 times out of 100, no, it's not. Sometimes you'll see jobs in academic positions where it's the only document, like they have a kind of a detailed offer letter, but there is no employment contract. But unless it says this is binding and final, it's not binding. If it's just a signature line at the bottom and maybe they sign it as well, you're not, kind of stuck with the terms in the offer letter. They expect there's going to be some kind of back and forth. So if you find that an organization has sent you an offer letter and you've asked them to make some changes and they just say take it or leave it, I find those organizations are generally tough to deal with down the road if you do have other issues that pop up. And maybe I'm doing a bad job of explaining it. If you have an employer who just has a kind of take it or leave it mentality about a contract or an offer letter, they're going to be difficult to work with if something pops up while employed with them. Maybe there's a scheduling issue or an efficiency issue or a workflow issue or a staffing issue. There's always things that pop up when you're working for a new position. And if they're saying a take it or leave it, kind of approach to a contract, it's very likely they're going to tell you to kick rocks if there's an issue involving other things down the road. So that might, be a decision-making factor in whether you're going to pursue a position or not, is how they react to some of the changes that you're asking for. Now, if you're going into private practice, it's more likely that you'll get changes. Whereas if you're entering into a contract with a large hospital or healthcare network, they kind of have more standardized contracts. They might be less willing to make major changes. Certainly, bonuses, comp, those are generally negotiable. Whereas if you're asking for big kind of verbiage changes in the contract and it's a giant hospital, they're probably not going to do that. So, all right, that's a little bit about offer letter mistakes as a PA. If you have any questions about an offer letter, employment agreement, independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.